post-traumatic stress disorder, PTSD, the kind of common definition is the body's normal response to an abnormal situation. Coming back from my last deployment to Afghanistan, I was diagnosed with PTSD and dealt with, debilitating panic attacks and anxiety and depression. And those panic attacks were certainly like a reflection of some things that happened to me. And basically I was waking up essentially like in the state of a gunfight.
Your body's doing what it's supposed to do. You're clearing out chemicals, adrenaline, all this stuff. It's disrupted your constructs of reality. So now you have to develop new ideology and new values sometimes if something just kind of crushed what you previously believed.
The body's doing what it's supposed to do in that sense.
Absolutely.
But staying there is the bad thing.
Staying there is the bad thing.
Lindsay Bira is a PhD and is a clinical health psychologist, medical professor, and speaker known for her work in trauma, PTSD, resilience, and human performance. A former psychologist for active duty military and veterans, Dr. Bira now brings evidence-based tools to a global audience.
If a soldier survived a bombing, the brain might say, I will never let that happen again. It may react to something back home, like fireworks, as if there's a similar level of threat, but there's not. Logic is overridden, and the survival brain is in control.
What got you to where this is your profession? Your specialty is this.
I was doing cardiovascular research, which is still a focus of mine. And then I also got into a trauma-focused lab. So I learned a ton about PTSD, specifically the crossover with PTSD and other issues. And we looked at if you have somebody who has had a trauma and has PTSD, but that PTSD is not treated, then over time they have greater risk of developing heart disease, cancer. If they already have a condition, then the markers of their condition are a lot worse. But if you offer evidence-based PTSD treatment, and you get their symptoms down, and you can actually mitigate the development of long-term health issues.
What's some examples of retraining?
There are two things that usually work best with something like panic, which then ties back into PTSD. One is exposure therapy. So this is where...
Is this prolonged exposure therapy?
This can be prolonged exposure, PE, exactly.
I did it for a year, and I was completely closed off to people like you before that.
Yeah.
Because I had such a bad experience with the VA that through a cognitive therapy that I just felt like I get exhausted by it. And I could tell you from the work that I do at Mighty Oaks Foundation and the thousands and thousands of veterans we treat with anxiety, depression, acute stress, PTSD diagnosis, like major issues. The approval rating of the VA mental health system is the actual stats are like 70% disapproval rating.
America's military veterans deserve much better. That's the conclusion of a congressional commission on health care at the Department of Veterans Affairs.
I was a psychologist for the VA for many, many years. I did a lot of my training there, and I think it's understaffed and people are getting, frustrated. It was hard. I would say it's very hard to be there. I think it's also, people get forced to see you. So you're not, people aren't choosing to see you sometimes. And sometimes people maybe aren't motivated to get better. There's a lot of complexities in there. So the burnout rate is very high. I had a patient who, a pretty high performing professional who had a plane phobia and hadn't flown on a plane for 12 years. And then finally needed to take this trip and just said, do you think I could ever get over this? And I said, yes. And then sure enough, in 6 to 8 sessions, he flew across the world. I think that exposure therapy, it's evidence-based and done in the right way. It unlocks a ton of that trap that anxiety brings.
The last part of this, I really want to get into the word resilience and resiliency and how that applies to you, how that applies to the show, all the listeners. Mind, body, spirit, social, all 4 pillars. You have to be mentally tough, physically tough, endure life. You have to be socially connected to the right people, surround yourself with the right people. I believe also that 4th pillar, the spiritual one, you have the strong spiritual foundation. When you think about resiliency, what's resiliency mean to you? What's being resilient, a resilient human being look like to you?
Yeah, the way that we define resilience in the field is when a trauma happens or a big stressor, resilience is the ability to bounce back pretty quickly. So you return to your pre-crisis state relatively quickly after something has happened. Post-traumatic growth is even better. Post-traumatic growth is, yes, you bounce back, but you actually become better because of what happened. It was a catalyst for your own growth and change. Maybe your relationships get deeper, maybe the way that you're contributing to the world gets more profound.
In those early stages, are you totally against medicine?